Hi, Dr. Grant.
Hello.
Can you tell me a little bit about your profession here at Kitson?
All right. I'm the district medical officer
Right.
for Kids and Home. We serve a quite large population.
Mm-hmm.
Can't give you numbers, no, but I mean, I know for sure in terms of our chronic illnesses, we've been gradually updating our register, and we are at almost 400 persons. And when I say chronic illnesses, we're talking about hypertension, diabetes. And that's in addition to people who come with asthma and other medical conditions, as well as the people who just walk in miscellaneously for a pain in the foot or cough, cold, fever, as the case may be. So we do treat a quite large population here at Kitson.
Okay.
I've been here for 2 years. Yeah, 2 years. Previously, I would have been at the St. Jacob Park Health Center,
That's where I know you
where
from.
I was a part of the HIV STI unit, as well as the general medicine department as well.
All right. So, and basically, that's what we're going to be talking about today, STIs. So, can
Okay.
you start off by telling me what is an STI? STD.
All right. So STD, STI, right? The terms are used interchangeably.
Right.
Sexually transmitted infection, sexually transmitted disease. And as the term suggests, these are illnesses that are contracted and spread through sexual intercourse. I probably should say sexual activity,
Right.
because really and truly, one can contract an STI without the actual act of sexual intercourse. But once there's exchange of genital fluids, then there can be transmission. So an STI is an illness that is transmitted through sexual activity.
Right. All right. So, can you tell us some of the different STIs slash STDs that are out there?
Right. So for ease of presenting, we can put them in categories, right?
Mm-hmm.
So we have, and maybe the more common ones that persons would probably think of firstly would be the genital discharge.
Right.
We call them genital discharge syndrome, right? So a syndrome technically refers to a, you can use the word constellation or a group of signs and symptoms, um, which may have varying or various causes, etiologies. So the signs and symptoms are similar, right? But the cause may be varying. So we put these signs and symptoms together, and we have what we call a genital discharge syndrome,
Right.
which means then, as the terms suggest, that these illnesses are characterized by abnormal or unusual discharge, right? Synonyms, so the persons can understand what we're talking about. Secretion, drainage, right? So when we talk about discharge, we're talking about something draining from a particular body orifice. In this case, it would be the penis in the male and usually the vagina um, in the female.
And do these discharge come with an odor?
Right. So we can talk about the accompanying symptoms that would come with the discharge, right?
Right.
So the main symptom would be a discharge, abnormal secretion or draining from the penis or from the vagina.
Mm-hmm.
Accompanying the discharge may be itching, odor, as you mentioned, um, lower abdominal pain, and also the lymph nodes in the groin become swollen.
Right.
Lymph nodes are usually enlarged or swollen when there is an infection or inflammation in a nearby site. So usually the groin lymph nodes are enlarged in the presence of an infection in the genital area. So that's the genital discharge syndrome. And under genital discharge syndrome, we have gonorrhea, we have chlamydia, we have, in the case of the female, there is the BV, bacterial vaginosis. There is a trichomoniasis, or trick, as the females may call it. And there are some other etiologies. Etiologies mean cause or the underlying cause, that may be not so common in terms of people knowing the names of them, but they cause similar symptoms. You have the mycoplasma and ureaplasma that are very much prevalent in society and cause discharge, burning. Did I mention burning too with
No.
urine? Right, so that's one of the accompanying symptoms, with the genital discharge syndrome. Right? So the abnormal secretion, itching, burning, low abdominal pain, and enlarged lymph nodes. These are usually the signs and symptoms that would be present in a genital discharge syndrome or in one of the infections that come under the category of genital discharge syndrome. We have a genital ulcer syndrome. Another word for ulcer is sore, right? So these are characterized by sores in the genital area, sores on the penis, sores on the vulva, meaning that's the outer external parts of the female genitalia. The sores may be inside the vagina. So I will now mention the genital ulcer syndrome.
Right.
And genital ulcers, another word for ulcer is sores. So these are the infections that are characterized by sores on the penis, on the vulva meaning the external part of the female genitalia. The sores may be inside as well and not necessarily visible to the eye externally.
So let me ask you that before you go any further. So if the sores are on the inside, what would allow the patient to know that there are sores on the inside?
You may not. You may not, as well as it may be the presence of discomfort
during sexual intercourse.
So discomfort during sexual intercourse may give some indication there's something going on inside. But the major or the most commonly known genital ulcer would be that of syphilis.
Right.
And the thing about syphilis is that many times the sore is missed.
Right.
In most occasions, syphilis is diagnosed by a blood test long after the initial stage of the infection would have passed. And in the female, the sore could be inside the vagina and she never sees it. So this woman, this female would never actually be aware that she would have contracted syphilis until further on, for some reason, she does a blood test and it shows up positive.
Right.
There are other ulcers, not so common. I mean, if you were to look at pictures of these on Google and so forth, it would be, quite disturbing. I mean, very extensive sores. I mean, in Jamaican terms, we would say like it a rotten off, that it can get that bad. We talk about our granuloma inguinale. We're talking about our lymphogranuloma venereum, right? Big words, but basically they form very bad, uncomfortable sores on the penis. They can spread to the rest of the inguinal region, inguinal meaning groin. We talk about also perineal. So the perineum is that area between the genital and the anus. So going around from the genital towards the anus of the perineum, those areas can also become infected.
Right.
So that's a genital ulcers. They form sores. You have warts, genital warts, which are caused by a virus. And the Ministry of Health has been, very much out there now in promoting HPV vaccination because warts are caused by certain types of the human papilloma virus. That's what HPV means.
Right.
So HPV is very much prevalent among the population. Practically anyone who has been sexually active more than likely would have been exposed to HPV, which is why it's important that the young people, before even becoming sexually active, are vaccinated, as it adds an extra layer of protection.
Right.
Sexual education, responsible sexual activity, we can't stress that enough, but the vaccine would add an extra layer of protection, especially to our young people, in terms of protecting them against HPV. So warts are caused by human papilloma virus, certain types. There are many different types of HPV, and some types are associated with cancer of the cervix. So to some extent, cancer of the cervix is also not, it's not a STI, but the more partners that a woman has and the earlier she begins sexual activity, the more at risk she would put herself of developing cancer of the cervix.
And you would discover that through a pap smear, right?
A pap smear.
Okay.
That is correct. That is correct.
All right. So, Doc, how do we start to educate persons? Because there is reports that STIs are more prevalent now. It's on the rise. So how do we start to educate the wider public on STIs, STDs, HIV, etc.?
I'm not gonna jump to the school just yet. I think we should begin at home.
Right.
I think we really should begin at home. You know, in today's society, the young people have information literally
At
their fingertips. You know, the gadgets, the phone, the tablets, the internet, the you know. So parents really should be aware and should know, you know, the kind of material that their children are consuming, right? As well as talk to the children about these things. I mean, you know, gone are the days when we should be really feeling that these things are taboo and telling the kids about birds and bees. I mean, we really should be, you know, we have
talking to them
yeah,
straight.
let's just get straight and talk. You know, I know the schools are helping. I mean, they have what's the name of the course?
I don't remember. I heard my son talk about it when I was going to school. It was when I was going to school, it was guidance.
Yeah, HFLE I think is
Right.
is the term, human family life
I'm
education.
not sure, but it's something similar.
But I think that's a good program to have
Right.
rolled out in the schools. Because I mean, you know, where it's missed at home, you know, our teachers and this week was Teachers Day. You know, shout out and big up to
the teachers.
You know, the teachers. I'm where I am today because of my teachers.
Right.
And you know what's missed at home. Many times the teachers have to pick up that slack, so to speak. The teachers have become teacher, pastor, parent, guidance counselor. Teacher is everybody, everything. You know. So our teachers are really doing a great job in terms of guiding the young people.
So what about the health center though? What is being done in the health center?
That's another layer now that we can add to the education and promotion of responsible sexual practices, responsible sexual activities. So we give talks in the health centers, right? So there are, you know, with the midwife, you know, as when she sees her patients for family planning, when she sees her patients for antenatal or postnatal, the public health nurse, you know, when she's seeing her population in terms of vaccines and so forth, the doctors, the registered nurse. So as we interact with patients and as they express to us also their concerns and their questions, you know, we do our part in promoting responsible sexual activity. There is literature that we can give out. There are posters on the walls so that when persons come in, they can read. So in various ways, we do our part in not just treating, not just trying to cure, but as
you also provide free testing as well.
Prevention, better than cure. Testing is available. Anybody can walk into any health center and request that the HIV test be done, the syphilis test be done. There are other tests that can be done for the other STIs, but unfortunately they are not available in the public primary care setting. They can be accessed privately. And I would take this opportunity to encourage a couple who is, you know, considering taking that next step, taking their relationship to that next level of intimacy.
Go and get tested
becoming
together.
Sexually intimate. Go and get tested together.
But you know what's so funny? That it's funny that you say that. Like I notice, especially for the males, when you tell them, listen, you need to go and get tested. If, for example, you're dating someone, they're a bit hesitant to go and get tested. Why is it like that for the males?
Why is it like that? Well, I don't know. Maybe I think that there's this I don't know, invincibility complex with men. They feel like, you know, I'm a good man. I do my thing, and you know, in Jamaica we have this we put this confidence in our herbs, and not saying that they are bad, but I mean we can't be trusting in steamed fish and okra and Irish mash to be protecting us um, from illness, sickness, and infections and sexually transmitted infections.
And also, we can't look at someone and say what they have to. So, ladies, make sure, males, make sure you meet someone, you go and get tested. You can't look at a person and tell what they have. You have to get tested.
Have to be tested. And there's, we talk about safe sex, right?
So even after testing, we should still practice safe sex.
Right, but what really is safe sex? Because safe sex,
sticking to one partner.
Exactly, that's where I'm getting to. It's not about wrapping it up. Yes, it's important to put on the condom and wrap it up, and there are other barrier methods too. You have the female condom, you have the male condom, but getting tested, right? Making sure both persons are free of infection, or if there is an infection, make sure both persons get treated and are now clear, and then you stick to that one safe partner, right? So that's really the safest way.
In the Caribbean or in Jamaican terms, man always a man to be jealous. And you think we're at a stage where we need to get rid of that mentality and focus.
And it would begin in the home. It would begin in the home. I mean, the family unit is really the building block, that first element, that elemental block of society. And a lot of the issues we're having in society, really and truly, until we're able to get to the family structure, it's gonna be a real uphill climb, uphill battle. So it really has to begin at home. That our boys see good examples at home and grow with that in terms of their morals and values. Saving that, then the school, church, these are, we call them agents of socialization. So it would have to be a multidisciplinary approach. It still takes a village to raise a child. I think we're moving away from that, but it still does take a village.
I also know that in the health center settings also there are condoms and family planning that is offered.
Yeah.
Can you tell us a little bit about that? Is it that you can just walk in and get your condoms and your family planning?
Right. The family planning would be as per the schedule. So a woman would have to approach the health center and find out the scheduled days when this is given. Once condoms are available, once there are condoms in stock, then these are freely accessible.
Okay. All right. And we also spoke about the testing in the health centers. Is there any way else that persons can get tested? I know sometimes you used to have the bus out. You have persons on the streets. Do you know like some of the areas that persons can find these persons to get tested?
They still do go out. The bus still goes out. The team of persons, refer to them as behavioral change, BCC, behavioral change and counseling. Yeah, they still do go out in the communities. They go to the schools. I know various anywhere that the clubs. So it's for the person who was really interested in taking that taking up that responsibility in terms of protecting themselves and their sexual partner, to really seek. And once you go to the health center, information is readily available, care is readily available, treatment, if necessary, is readily available.
Okay. All right. So now, finally, what's your advice for persons out there that are sexually active, thinking about being sexually active, and for our parents and teenagers who are out there? What's your advice, seeing that there's an increase in sexually transmitted disease?
I'm gonna go to the Bible. We are told that we are fearfully and wonderfully made, and that our bodies are the temple of the Holy Spirit. So really, if we look at ourselves as being made in the image of God and being valuable in that regard, then we wouldn't want to contaminate, our bodies with anything that would detract or take away, from our being fearfully and wonderfully made. So it's about valuing self,
Right.
seeing yourself in the eyes of heaven, and how we are valued, so much so that the heaven would have emptied its most valuable trophy on our behalf. So in giving of ourselves to God, then we take care of the body as if it were, that valuable. We have been given such wonderful bodies. I mean, sex was created for the human to enjoy, but as with anything that God has created, there's always a counterfeit and something that would want to take away and to corrupt it and make it something bad. So I'm saying to persons out there, anybody, see yourself the way God sees you, as valuable, as being fearfully and wonderfully made. Sex is made for us to enjoy, but there is a context and a right way of doing things. Choose one partner, get tested, both persons are fine, be faithful, and enjoy.
Okay. All right. So remember, parents, talk to your kids. Don't be afraid to let them know what an STI is, an STD, what HIV is. Teach them about using protection. And us adults, we need to be responsible. Once we're starting a new relationship, make sure that we go out, get tested. Don't be afraid to go and see your doctor and talk to your doctor. And the safest way is to stick to one partner. All right, guys, take care until next time.